Hello and welcome back to ESICON 2018, the 48th National Conference here at Bhubaneswar, and we have Dr. Rajneesh Mittal, young endocrinologist of our nation, all the way from Haryana to the city of temples, Bhubaneswar. Hello sir, how are you doing today?
Hi, I'm good. How are you?
I am great. So you've been a part of ESICON 2018 earlier as well, and this is for the very first time that you've come down to Bhubaneswar. So how has the experience been so far? You were here yesterday, so could you please share your insights with our audience about yesterday?
It's really good. I really love this place. I have come to this place very first time, and I have heard a lot about Bhubaneswar and surrounding places and the temples, as we used to read in our classes about this Kalinga university or their empire, the temples they were associated with. I would really love to see around these places, and on top of that, it's really good that this time ESICON is happening in Bhubaneswar. ESICON itself is a very big feast of academics, and we do get to meet our friends, our teachers, and share our experiences, and with that we can see places also. I am really loving this place so far.
That's great, doctor. Also understanding from the young endocrinologist of our nation, what are the kind of trends or traits have been so far, and what kind of challenges do you face as far as the Department of Endocrinology is concerned?
See, I still feel that when we are doing our own practice as an endocrinologist, our people of the country are still not aware what exactly this endocrinology deals with. So I think somewhere we as a people from endocrinology do lack in making people aware as to what diseases this endocrinology branch deals with.
Right.
Because most of the people just acknowledge thinking that this branch is only dealing with the diabetes or some thyroid disorders. They really don't know as to what are hormones and what all hormones we deal with, and what are various problems that are associated with different problems of hormones. So I think it's a very important aspect that we should touch as a public awareness, so that even patients do not get misguided for their special endocrine problems, and otherwise also like diabetes or thyroid, so that they know that we have to approach a right doctor in a right way.
Correct, correct. That absolutely makes so much sense. In fact, we had one of the senior doctors, endocrinologist with us, and he just mentioned to our audience and fellow physicians a note, quick giveaway note for them, that make sure what your patients are reading on net.
Yeah,
You know,
exactly.
so
It's
much
very
of-
important.
yeah,
Because
exactly.
now when patients come to our OPDs, they will ask some questions which they have heard either from their neighbors or from the internet, and it's really surprising to hear what kind of questions they are putting, and even what message you give them. They still take it with a pinch of salt as to whether the internet information is more authentic or the doctor is telling us the right information. They still have those confusions in their mind. It's difficult to clarify and make them understand.
Sure. Let me also let our audience know that Dr. Mittal will be chairing for one of the upcoming sessions, pediatric adolescents endocrinology to be very precise, and let's hear it from Sir himself. So what do we look forward from your session?
Yeah, so as last we discussed that people don't know, so this is another aspect of this endocrinology, basically a special reproductive related problems with the children or adolescents that they come across. We are going to talk on that. I'm going to chair a session on that. It's about if on children who do not really get mature reproductive wise, or who have immature genitalias basically, and it goes unnoticed many a times. Parents really do not know as to what is their maturity and whether they are maturing it in a right way or no. Another problem is that we are going to discuss is about congenital hypothyroidism. Hypothyroidism is a very common situation, but people think that only elderly people can have this problem, or only a woman sect will have this problem, but they really don't know that even it can be present from the birth itself. the awareness to make children and the doctors of our country to make them aware is so important, so that a national screening program should be started by the government of India, because it is one cause which is a totally preventable cause for mental retardation. If we really do not diagnose congenital hypothyroidism at the time of birth or within few hours or days, a couple of days of birth, patient or a child can have mental retardation. It is a potentially treatable cause for congenital hypothyroidism. So we should be very careful in assessing such children when they come to our OPD. So that is one topic that they are going to discuss about hypothyroidism, then about as I said, sexual maturity of the children, and some ambiguity related with the reproductive maturity of the children. I'm sure that this topic is a burning issue. It's a very important topic, and it's going to be very interesting, and we really look forward to listen to their experiences and share the knowledge and go on learning more and more from this session.
Sure, since you've mentioned that you are also keen on having to gear up to listen to from the experts, so what are the areas of interest or the topics that you are literally looking forward to hear from our experts here at ESICON 2018?
Endocrinology is a very interesting topic, and I think all the topics in endocrinology are interesting, but my point of interest is more into the reproductive endocrinology. I do have interest in infertility and the approach to infertility,
Yes.
and how we can help our patients. So there are very interesting topics on specifically on these topics also. I really look forward to listen and share the experiences with
Sure,
them.
similar areas were covered yesterday in the symposium as well, and we are looking out for the
Yeah,
upcoming
yeah,
sessions.
yeah.
So thank you so much,
Yeah, thank
Dr.
you.
Rajneesh, for joining in with us.
Thank you so much.
That's about it on ESI TV. Thank you.
Thank you.